Triglycerides are a type of fat found in blood. Excess calories consumed in foods, especially high carbohydrate diets, are converted to triglycerides in the body. Triglycerides are stored in fat cells in the body. They are released back into blood when needed to supply energy when you are not taking food. Triglycerides can also contribute to thickening of blood vessels, leading to heart attack and stroke. Very high triglyceride levels can cause pancreatitis or inflammation of the pancreas gland in the tummy. Triglyceride levels in blood are checked routinely as part of a group of tests known as lipid profile. Strict requirement for checking lipid profile in fasting state has now been taken away if you are assessing cholesterol levels. But for assessing triglyceride levels, it is better to do in the fasting state, as triglyceride levels can go up after a meal as more high-calorie substances are added to blood. Unusual rise in triglyceride levels after a meal can also be significant, though tested less often. Simple way of reducing blood triglyceride levels is to reduce the intake of calorie-rich food, which will include high carbohydrate food in addition to fatty food. Alcohol and high sugar food also increase triglyceride levels significantly and are better avoided if you have high blood triglyceride levels. Fried food also come under the category of foods to be avoided. Food containing hydrogenated oils or fats are also not ideal. Saturated fat containing food like meat may be substituted with fish, which contain omega-3 fatty acids like salmon or mackerel. High triglyceride levels are part of the metabolic syndrome in which fat gets deposited around the waist. Other components of metabolic syndrome are high blood pressure and high blood sugar. Metabolic syndrome carries a high risk for heart disease and stroke. Peculiarity of blood fat levels in metabolic syndrome is a low HDL cholesterol along with high triglycerides. HDL or high density lipoprotein cholesterol is the good cholesterol which protects against heart and blood vessel disease. Weight reduction is another important method of reducing blood triglyceride levels. Regular exercise of at least 30 minutes a day is very useful. Change in lifestyle at work, encouraging more physical activity, is another good option. Using stairs instead of lift and walking about during breaks from work are simple options to increase physical activity. Exercise brings down triglycerides and raises the protective good cholesterol known as HDL. There are various medications available for treatment of high triglyceride levels, which have to be taken under medical supervision to watch for potential side effects. Desirable level of triglyceride is below 150 mg per deciliter. Levels between 150 to 199 mg per deciliter is considered as borderline. Levels between 200 to 499 mg per deciliter are considered high, while levels above 500 mg per deciliter are considered very high. High triglyceride levels can also occur as a side effect of certain medications and in certain diseases like hypothyroidism, low levels of thyroid hormone. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video.